One of the greatest challenges to physical therapy practice today is unwarranted variation. Unwarranted variation is when the variability of care is not related to any characteristics related to the patient's condition or their personal preferences. The real path to excellence is robust standardization to combat our daily clinical chaos. The clinical world is a chaotic environment. We struggle with all of the different aspects of providing care to our patients. So when we have an opportunity to standardize in order to improve the care that we deliver, but more importantly, the outcomes that our patients experience, that is the thing that we need to embrace. Using guidelines and outcome measures, they really inform the physical therapist. And when that physical therapist creates systematic principles for measurement, interventions, and they have outcome benchmarks, it truly allows us to be unburdened. And with that unburdening, we can spend our time and energy on being a springboard of innovation for best practice in clinical care. So one of the real goals with change is to say, how willing am I to change and where am I on that change tolerance, and match that to the interventions that you do. Here at UD, since our change tolerance is very high, we tend to be quick to develop protocols and guidelines, and then we push those out to the community to allow them to adopt them so that they can determine how far from those protocols or rehabilitation guidelines might their care be today. It might not be as big of a change as they think, or in some conditions it could be a much larger change. So Delaware has done a really good job of being an incubator to develop rehabilitation guidelines that then are shared by our colleagues across the country.